This is Good Morning San Diego.
Good morning, everybody. It is Monday.
A lot going on in this hour. Speaking of Monday, it's Melanoma Monday.
Yeah, that's right. And coming up, we're going to talk to Dr. Palm, Dr. Melanie Palm. She's got some ways that you can protect yourself this summer. It's, you know, we often see the May gray right about now, but boy, the numbers are pretty scary when it comes to melanoma. It is the most dangerous type of skin cancer and the leading cause of death from skin disease. Also ahead, we're talking skin cancer prevention. Today is National Melanoma Day. We'll tell you about an event coming up so you can stay healthy. Today is National Melanoma Day, and we want you to be safe and healthy. And so we want to remind everybody how you can protect yourself. Joining us this morning to talk about this is dermatologist Dr. Melanie Palm, along with Valerie Griggs this morning. Thank you both for joining us today.
Thank you for having us.
You know, this is such an important reminder, and this is something we should talk about more than just on Melanoma Monday once a year.
Absolutely. So the American Academy of Dermatology has designated today, May 7th, Melanoma Monday, but actually the whole month is Melanoma Awareness Month. So we wanted to be able to give some of your viewers tips on prevention as well as detection of melanoma.
And that's so important. Valerie, share your story. You were recently diagnosed.
I was. I saw a spot on my thigh, and a friend of mine actually brought it to my attention, and so I went in to see Dr. Palm, and I was diagnosed with melanoma.
Wow, and this was just a few weeks ago.
It was, yes.
So then what happened?
So then Dr. Palm basically did a test, and it came back positive, and I found out about a week later, and I came in, and she did surgery and cut it out, and we found out a few days ago that I'm clear.
Oh, congratulations.
Yeah.
That is such great news. And that's the key, right? Detection.
And that really is the key. So melanoma can be a devastating disease, but early detection, getting it when it's really thin, there's such a high cure rate. So that's really what we want to look out for.
Okay, so what are the signs? What should we be paying attention to? I know you brought some products as well.
So yeah, so there's A, B, C, D, and E. So if you remember anything, remember the alphabet. Okay. So the A stands for asymmetry, the B stands for an irregular border, the C stands for having more than a couple of colors to it. The D is a diameter, so having a diameter bigger than a pencil eraser. And E is the most important, so that means something evolving, so new or changing. It's itchy, painful, bleeding, or just a new spot in general.
And so it doesn't have to be something that's raised or looks irregular, just any sort of a new spot.
Exactly. You know, there's types of melanomas that are sometimes without pigment, so they can look pretty, you know, innocuous. So really just anything that's new or changing.
And we do have some pictures. Tell us what we're looking at here, doctor.
So these are actually two of my patients that have had melanoma. Now, I think this is a good example. The melanoma is the one that's centrally located at the bottom of the screen. It's black, and it looks unlike everything else. So that's really that ugly duckling, and that's sometimes what we tell patients to look for is the mole that doesn't match the rest of yours.
Okay, and that's just something you got to look out for, especially as you're spending more time in the sun.
So monthly self-exams for you, and once a year taking a look with a board-certified dermatologist. And this is actually Val's own melanoma. So our patient that we have here today, again, her spot had red, brown, you know, white color in it. Again, colors, and it was changing over time. That signaled her to come in and see her dermatologist.
And that's exactly what you're supposed to do, right?
Exactly.
Valerie, what did you think when you first heard the news? Because I know that you're really conscious of skin and health, so this was probably shocking for you.
I was shocked, actually, because I never thought in a million years I would have any signs of melanoma. So I was really grateful that somebody pointed it out, because I probably wouldn't have even gone and had it looked at otherwise. So it's really brought a lot of awareness to me and getting checks, you know, more periodically. But I'm grateful for Dr. Palm to have found it and have gotten it out.
And let's talk about prevention, because that's the other half. You've got to wear the sunscreen.
Exactly. And so actually the FDA just came out with a new rule on sunscreen. So you want to see something that's broad spectrum, which means it covers UVA and UVB. It should be at least SPF 15, but I really personally like 30 or more if you can do it. So I brought two lines. This first line by 8am is actually dispensed just through physician offices. It's got a high percentage of zinc oxide. Zinc oxide and titanium dioxide are physical blockers and are great to have in your sunscreen. This second set, which is probably familiar to you over the counter, is Neutrogena. It's a great line. They have all sorts of lines from sprays, as long as you cover it evenly. I think those are great applications. Ones that dry on contact and other ones that can be used on the face.
Do you have to spend more on these types of products for them to be more effective?
Not necessarily. The important thing is what's the active ingredient and what's the coverage and what's the SPF. And just as a reminder to your viewers, you need to apply about an ounce for the whole body, which I kind of give people the reminder of a shot glass.
Okay, let's hold this up for camera 3. That's a lot of sunscreen.
It is. It's actually only about 4 applications per bottle of sunscreen. So all of us are under applying sunscreen, and you should really apply every 2 hours, even more frequently if you're really out and doing a lot of things, being active in San Diego.
Okay, keep this in mind. Shot glass full of sunscreen.
Exactly.
All right, you guys have an event coming up that's going to help anyone who's looking for prevention and more information.
We do, even more appropriate with Val's more recent diagnosis with melanoma. On May 23rd at 20 Lounge, we're going to have a Ready, Set Summer event. We're raising money for the Skin Cancer Foundation. It's our 2nd annual time. We're going to have free manis and petties. I'm going to do free skin cancer screenings. And we're even doing some discounted Botox vouchers to encourage people in the community to come in and really learn about skin cancer.
That's great. Education is key when it comes to this.
Definitely.
Dr. Palm, Valerie, thanks so much for coming by, and
you.
we're so glad to hear that you're doing well, Valerie.
Thank you. I am.
Great
Thank you.
news. Thank you guys so much.